Hey everyone, good morning and welcome to another edition of Coping with COVID. I am the membership director of the Chambersburg Chamber of Commerce, Jordan Nace, and I am really excited to have a guest on today from one of our stakeholders within the Chamber, Franklin Hospice. They're brand new to the Franklin County community, and we're so happy to have them in our Chambersburg Chamber of Commerce. I have today with me the CEO of Franklin Hospice, Mr. Ernesto Lopez. Ernesto, good morning, and thank you so much for being here this morning.
Hey, good morning, Jordan. Thanks for having me. It's a pleasure to be here today.
So how are you, my friend? How is it in the hospice world right now? Is everything still going well? I'm sure there in the beginning, it's not necessarily like it's slowed down, but I imagine a lot changed in your world. So how have you been?
Well, like many of our healthcare providers in the community, it's been tough. Lots of challenges. I think we've learned how to adjust and pivot, on the dime, and in order to continue to provide, the services and the quality of care that we are all known to provide. But it's been a rough few months for us, like it's been for everyone in the world. But we're doing fine. We're blessed to have lots of support and a great team that's been able to adjust and be able to continue to drive our mission.
Well, speaking of a great team, I know Karen Giffen very well. And so I don't know necessarily, I guess, the whole entire team, but that one individual, she's a great person to have on your team. I know she's going through the leadership program right now,
Okay.
and Ginny speaks highly of her. So we're happy to have her involved in that program. And again, just really happy to have you here in Franklin County with us now.
Thank you. Karen is wonderful. She does a wonderful job for us, and we're excited to be in Franklin. It's been, for us, our organization, our parent organization, Hospice of Washington County, has been in existence for over 40 years. And a few years ago, we based on some of the needs that we were seeing in the Franklin County community, we felt like it was part of our mission to go out and extend and grow into that area. And we're so happy to be in the community. It's been a slow start with COVID, but already we've taken care of several families and patients, and we're already making an impact in our short time here.
Well, that's wonderful to hear, Ernesto. I have some questions here in front of me that I wanted to kind of go over here, about 8 questions or so. So we'll go through this, hopefully hit a couple other topics and go from there. So just the first thing I have is why is it so important now more than ever to call Franklin Hospice for a loved one? I think a lot of people aren't necessarily sure exactly what to do right now. So why is that
Sure.
important?
The process of death and dying is a difficult one to talk about. It's taboo in our society, and unfortunately, what happens is that it's inevitable. We're going to be faced with these challenges, and being able to have the type of support and the services that you need during these difficult times is critical. At this time, people are a little bit weary. They're unsure because of COVID-19. A lot of the home services have been cut back. Our nursing homes, who do a wonderful job, are struggling because their residents can't be in contact with their loved ones as they did before. Facilities are locked down. The hospitals are very restrictive. So it is a very challenging time, and folks are unaware, or they're unsure if hospice is still something that's a service that's available to them. And so I would say absolutely yes. Hospices, or we have continued to go out and visit and support our patients and families. We are, absolutely using and following all the protocols to ensure that our staff is safe and that we're not transmitting or contributing to COVID-19. And we've had a great track record these last 6 months. And so our patients and families are getting the care that they need. I think it's just making sure that people are comfortable with having folks in their homes, which is probably the biggest challenge. But we want to make sure and rest assured that our staff is taking all precautions. We're monitoring them very closely. And like I said before, we've had a great track record these last 6 months.
So you essentially, kind of touched on my second question here, Ernesto, but I mean, to maybe get more in detail on that, it may seem counterintuitive to bring hospice staff into your home, when all you hear is social distance, social distance, social distance, wear
Sure.
a mask. But what are, the ways that you're protecting, not only your staff, but, the patients that you're seeing? Are there certain protocols that you are taking?
Absolutely. So we're actually doing it's a two-sided process. We want, first of all, we make sure to monitor our patients and their loved ones, and we want to make sure that we understand if they are having symptoms or if they've been exposed to people. We want to make sure that they're communicating with us. It doesn't mean that we'll stop seeing them, but we want to make sure that our staff is aware as they're going into these environments where there's uncertainty if there's been COVID. We're monitoring our staff daily. And so our infection control practitioner does a wonderful job of keeping in touch with our staff. Everybody has the supplies, the personal protective equipment that they need. If anyone is traveling out of the area for time off, we're monitoring them. We're creating quarantine scenarios for people if they're going to areas where potentially there's a higher propensity of COVID. And in our buildings, we have a infrared temperature cameras set up so that if somebody walks in, we know right away if they're febrile or not. We're also now looking at disinfecting equipment that we want to implement in our inpatient facility in Washington County. So we're trying to stay ahead of the curve here in ensuring that, anywhere where one of our patients or family members may have contact, whether it's staff or facility, that we are taking the maximum precautions that we can to ensure that we're keeping people safe. And that's been our drive since day one.
It's my heart goes out to you all in that field, because it's a little different where it's not like you're in just maybe a warehouse facility or something where it's obviously important to keep COVID tracked as well, but within in
Right.
your line of work, you have to be overly cautious. And so yeah, hat goes off to all of you guys for what you're doing to remain safe and keep not only your staff, but again, your patients safe.
Thank you, Jordan.
Yep. So, can you tell us some benefits that you give your patients, such as emotional support, since it's, so challenging during these times for some of your patients? I don't know what your protocols are exactly for, for folks to be seeing one another, but
Mhm.
from a family standpoint. But what are some things you're doing from an emotional support standpoint?
Emotional support is probably one of the most underrated services or aspects of hospice care that doesn't get spoken about as much as it should. And a lot of people, especially now, aside from having to deal with death and dying and just the emotion and the challenges around it, now we're dealing with a pandemic, and people have a tremendous amount of stress, work, kids in school, and now having to manage a loved one whose health is declining. All those pieces are just are ramping up to a really bad situation for people. And so for us, we have trained counselors that are available to support our families and our patients when these moments of challenge and duress come by. We have social workers that also work with our families to try to identify any issues, things that we can get involved with, we can help them with. And not everything that we do is specifically related to end of life. We are looking at psychosocial opportunities to be able to help patients and families. We work with different organizations and communities if we see that there's a need, whether it's physical, whether it's monetary, or whether it's emotional. We're trying to figure out the best way to coordinate care for these folks. And it's not just the patient, it's their families as well. So it is important for us to have this service and to be able to extend that. And it's a service that's open to all family members of our patients. It's not something that we charge for. It is a gift that we give back to families, because our philosophy of care is all inclusive. It's not about the single patient, it's about the family unit and how this journey of end of life affects all these different individuals. So having support for them on an emotional level is key and critical to the success of our services.
Ernesto, I saw something that you provide spiritual care as well. So, is that, tied in with, emotional support, or what exactly does spiritual care mean, if you don't mind going into that?
It's a great question. So a lot of people don't know that for hospice, as part of our benefit, when the hospice benefit first was created in the early '80s, there was a provision that basically ensured that every hospice provided spiritual support and care. And so it doesn't mean that the organization is religiously based or if it's a mission based organization or faith based organization. Every hospice has to provide a chaplain or a team of chaplains to be able to work with patients and families. And the work that happens there isn't necessarily about driving religion or driving specific views of religion. It's more about connecting with the spiritual side of this journey. And for many people, there is there's a tremendous drive and connection to having spirituality in their lives when they're going through end of life. And so our staff, our chaplain staff, help coordinate that. It doesn't mean that we take if you are someone who belongs to a specific church and have your own spiritual support, we don't replace that. We help coordinate that, we supplement that. But a lot of times we find families that don't have spiritual resources. And so they benefit tremendously by being able to spend some time receiving that support from our chaplains. And they go into the home. Now, of course, we're also doing telehealth, so we do a lot of video chats, and it's another aspect of our services that's very unique in healthcare. There's no other service that has that requirement. You're going to find that in every hospice that you deal with. So very important as it relates to the entire scope of what we do.
Ernesto, COVID-19 has highlighted the need for advancement in care and healthcare plans. Can your staff help patients and families with these plans?
Absolutely. So part of what we take a tremendous pride in is care coordination. A lot of times we might get a referral for a patient, and that patient may not be ready for hospice. They may be very ill and may have a number of different healthcare needs, and so our work is to help coordinate and help guide people and what we define as post acute care, which is everything that happens outside of the hospital. So we will work with folks, whether it's advanced directives, whether it's receiving social services in the community, whether it's recommending nursing home or skilled nursing care, or even home health. All these different services, we will, if someone isn't appropriate for hospice, we will work with them to try to navigate them to the right source so that they can get the care that they need.
Do you offer bereavement services to your families?
We do. So bereavement is like emotional support, is a key and critical part of our service. We will work with families, typically for about a year. A lot of our families sometimes stay on board for several years. They get involved in group sessions, and they create their own little communities with other grieving loved ones. And so we've done a really terrific job of coordinating that. But again, it's one of those services that some people are very hesitant to try to engage with. We all have lost. If you've lost a loved one, it's very difficult, and the last thing that you may want to think of is going to therapy or trying to go speak to a counselor. But it is so important. Grief is different for every single person. It's a unique experience that some individuals handle differently. Some of them are able to handle it more effortlessly than others. But there are folks that need a lot of that support and help for coping and for managing. And especially now with COVID-19, as I said before, there are so many stressors that are happening associated with COVID. Having to deal with the death of a loved one is a tragic and horrible outcome, but it's one that that has the ability to have resources and services available to support them, so that these individuals aren't alone.
When's a good time to call Franklin Hospice? Anytime? I mean, I assume, you've answered a lot of questions. So anybody that's kind of, maybe borderline as to whether or not they should use your services. Are you guys available, at any time?
We are available 24/7. So that's the really neat thing about our services. You can call us anytime, even if you have a loved one and you're not sure if they're appropriate for hospice. We're happy to go out and sit with you, evaluate, work with your primary care physician, try to put together a plan. And sometimes they're not ready for hospice, but we will help guide families in making these types of decisions. Our access is 24/7, and our telephone number is area code 717-504-3465. Or if you want to learn more about us online, you can go to www.franklinhospice.org, and there you can get some more information and about what we do, and a little bit of history of our organization. But we're based out of Chambersburg. We have staff that's local. We've got a medical director that's also local, and so we're embedded in the organization, in the community right now as an organization, and we're looking forward to growing and expanding within the community and serving all the residents of Franklin County.
You guys are in a great area here in Chambersburg there at 209 Grant Street, right beside the Grant Street Lofts. You have a nice building there, obviously freshly built over in that area, and they're still building some nice buildings over in that area. So yeah, you're in a great part of town. And Ernesto, we're just so again happy to have you in here in Franklin County, part of our chamber, as a stakeholder in our chamber, even more so. So is there anything else that you'd like to add here today before we finish our interview?
Sure. I would just share with people to have confidence and feel comfortable and reaching out to us, because in these times when you don't know who to talk to or who to speak to, or you're concerned with COVID-19, know that, we are an organization that's very proactive. We are very conscious of that, of those challenges and issues. And we're keeping our staff and our patients and families safe during this time. So you don't have to have a specific diagnosis to call us. Call us to chat. We're happy to help. We're happy to give direction. And like I said before, sometimes you or your loved ones may not need hospice, but there are other valuable healthcare services in the community that we can help navigate you to. And that to me is it's a no risk call. The last thing that I would say is, a lot of people don't know that hospice is a Medicare benefit. It's covered 100% by Medicare, Medicaid, and all major insurance providers. So I would say that more than 95% of all patients that need hospice services are able to get those without any cost to them. And so sometimes people are concerned about, what it will cost them to access these services. We're blessed to have the hospice benefit available, and for it to be robust and cover, these critical services during a very difficult time in transition. So those are the two things that I would say stand out. And again, if you have other questions, please reach out to us. We're happy to talk to you, and we're happy to serve you and continue to provide these services to the community.
Ernesto, you used the word blessed, and I'm blessed that you came on here today with me to chat for a while. I haven't had the opportunity to see you, I believe, since March, since the last breakfast we had as a chamber. So really glad that I had the opportunity to chat with you today. I wish you nothing but the best. And if there is any way that I can help Franklin Hospice here in the future, you just let me know, and I'm willing to do anything I can to grow your brand and whatnot. You guys do a lot for the chamber, and we really appreciate it. So Ernesto, thank you so much.
Thanks, Jordan. Thanks for having me on.
All right, my friend, take care. Have a great day, and we'll talk to you again soon. Okay.
Take care. Bye-bye.
Bye-bye.